we have also been able to have risk communication and community engagement efforts that are ongoing to raise awareness about MPOX. However, we must note that there are other threats that have emerged, posing significant risk to public health and safety, including Marburg outbreak that was in Tanzania and Ebola that was suspected in Uganda. These two outbreaks remain active, heightened, and we have heightened risk of cross-border transmission into Kenya. And given our proximity and frequent cross-border movement, Kenya remains at high risk of importation, requiring urgent and coordinated action to mitigate the spread of these two diseases. We are not an alien country, and because of trade and travels between the countries that are around us, we are at high alert. And that is why meeting with the multi-agency teams is very, very critical at this time so that we can heighten our borders. And these diseases are highly infectious, and that is why we have anybody coming into the country has been screened. Over 3 million people have travelers have been screened at the ports of entry, with 419 samples from suspected cases that are undergoing testing. It is important to note that every passenger who is coming into Kenya right now is going through screening. And please let us collaborate with the agencies so that we are able to prevent ourselves from any impending risk that may be coming to this country. As you may very well know, we have been grappling with an ongoing MPOX outbreak, which has so far resulted into 41 confirmed cases across 12 counties. That is Nakuru, Mombasa, Busia, Nairobi, Kajiado, Bungoma, Taita Taveta, Kericho, Makueni, Kilifi, Kiambu, and Uasin Gishu, with 3 new cases confirmed in just in the last 24 hours. A total number of 271 contacts of the 41 cases have been identified, and 246 of whom have been monitored for the recommended period of 21 days. And 9 contacts have tested positive for MPOX, while 16 contacts are still being monitored. We are asking the hotel fraternity that they ensure that the materials that they use, such as bedding and clothing, healthcare providers, caregivers, and family members who come into contact with infected persons must be able to use protective equipment, particularly at this time when we are trying to contain MPOX and other emerging issues. Travelers that are originating from countries where these diseases are and present themselves with symptoms of Marburg, including fever, headache, lethargy, anorexia, loss of appetite, aching muscles of joints, stomach pain, difficulty in swallowing, vomiting, difficulty in breathing, diarrhea, along with their identified contacts, shall be required to complete the traveler surveillance form at the port of entry. All travelers again shall observe routine hand hygiene practices, including regular hand washing and use of alcohol-based sanitizers. Should you have or should you detect anybody with such signs, it is important to guide them to go to a health facility or call our hotline numbers, that is the 719. Let us continue working together to combat any form of disease that is a threat to our country.
This is a perfect opportunity to reiterate WHO's commitment to support Kenya in terms of strengthening its emergency preparedness and response capabilities. WHO has been supporting the Ministry of Health in training border health management officers in developing and updating emergency preparedness and response plans, including all the components. So WHO and its partners stands by the Ministry of Health.
we collaborate with the Ministry of Health, our partners, in order to identify the appropriate, to minimize the risks, as well as to provide the appropriate measures so that safety of the people in the Kenya remain as it is. So we thank to the Ministry of Health, our partners WHO, and all the stakeholders to contribute towards the minimizing the risk of the health during the phase of migrations.